Good morning, respected.
Hello, good morning to everyone. Now we'll start one very interesting session on lacrimal diseases, and we have three presenters. We start with the first presenter, Dr. Shraddha.
Good morning, respected judges and all the audience. Today I'm here to present a rare case of pleomorphic adenoma of lacrimal gland in a 12-year-old. I'm from Guwahati Medical College. Pleomorphic adenoma is the most common epithelial tumor of the lacrimal gland, representing 12% of lacrimal fossa lesions. Pleomorphic adenoma is the most common epithelial tumor of the lacrimal gland in adults. It typically presents in middle age and it is rare in children under the age of 16 years, with only a few previously reported cases leading to increased likelihood of misdiagnosis. These tumors often present with increased proptosis or hypoglobus, and they invariably require operative excision. We report one such rare case with its management in our hospital. A 12-year-old child presented with painless, progressive, non-pulsatile proptosis of the right eye for a duration of 20 months. The patient denied headache, numbness, orbital pain, or visual changes. Her family first brought the facial asymmetry to her attention. She had no significant medical or surgical history, medication history, or family history of the orbital tumors. Physical examination demonstrated proptosis, 3 mm, which is confirmed by Hertel's exophthalmometry, and anterior-inferior globe displacement without epiphora, blepharoptosis, periorbital sensory deficit. The uncorrected visual acuity was 6/6 with normal intraocular pressure. Normal anterior segment, pupillary and fundal findings were also within normal limit. Extraocular movements were intact without weakness, limitations, diplopia, or pain. This is the image of the girl, right eye. She had inferotemporal displacement. CT and MRI demonstrated a 20 into 17.2 into 21 mm contrast enhanced homogeneous soft tissue mass in the extraaxial superolateral right orbit involving the orbital lobe of the lacrimal gland with mild anterior-inferior globe displacement. The tumor was abutting the superior rectus muscle medially and lateral rectus muscle also. The optic nerve, the remainder of the brain, and the contralateral orbit were normal. No significant bony erosion was present. The other investigations that we did was complete hemogram, blood sugar levels, liver and renal function tests, X-ray orbit and chests were within normal limit. To avoid the biopsy tract seeding, we did not perform a biopsy. Here the MRI shows a ovoid-shaped soft tissue mass in the superolateral right orbital region, and the mass was contrast enhanced in the other image, figure 4. With assistance from the neurosurgery team, we did a lateral orbitotomy. An excision of the tumor en bloc along with its capsule was done. Final pathological examination was an encapsulated glandular neoplasm with squamous differentiation consistent with pleomorphic adenoma. The mass was sent for histopathological examination, which confirmed the pleomorphic adenoma. This is the picture of the girl after 1 year, the follow-up. Coming to discussion, the lacrimal gland pleomorphic adenoma has been rarely reported in the children and is not seen in newborns or infants. The youngest reported case was in a 5-year-old child. Bajaj et al. Reported 119 pediatric orbital space-occupying lesions, finding a 0.8% incidence of LGPA, whereas larger case series of pediatric space-occupying lesions reported no cases of pleomorphic adenoma. The most common clinical findings of pediatric LGPA are similar to those reported in adults: lateral upper lid fullness, inferior globe displacement, exophthalmos, diplopia, blepharoptosis, reduced ocular mobility, or changes in the vision. High-resolution CT, USG, MRI all have been reported modalities of diagnostic imaging in pediatric LGPA cases. Rose et al. Proposed an algorithm for the pre-operative management of the lacrimal gland masses, where we mostly focus on the duration of the symptoms, pain, sensory loss, whether they are present or not, and radiological features. In benign masses, these algorithms assist in avoidance of biopsy, which could lead to biopsy tract seeding of the tumor cells with a higher risk of recurrence or malignant transformation. Our confidence in the diagnosis was strong, and pre-operative biopsy was avoided to reduce the risk of recurrence. The choice of surgical approach for pediatric lacrimal gland neoplasm is dependent upon the tumor location, size, and pathology, as well as the surgeon experience. Commonly reported direct surgical approaches include the anterior lateral superolateral orbitotomy, but we elected for lateral orbitotomy as it provides deeper exposure than the anterior approach and is most commonly described approach to lacrimal gland and extraconal lateral orbital lesions. Regardless of the approach, the goal of the treatment is mass excision en bloc with capsule intact to avoid myxoid component leakage. Even with complete excision, a 3% recurrence rate after 5 years has been reported. Benign mixed tumors of the lacrimal gland are rare in children. However, they must be considered in the differential diagnosis of pediatric orbital masses because of the prognostic importance of removing a pleomorphic adenoma with the capsule intact. These are my references. Thank you.
Thank you, Dr. Shraddha. Just wanted to know, did you give a course of steroids before to rule out pseudotumor of lacrimal glands?
Ma'am, it was started, but the patient didn't come for follow-up. She came after 6 months. When she first came, the patient had come from other center. She had already a CT scan report with her, so we did not start with steroids. She was referred from another hospital actually.
Okay. Because they say pseudotumors are more common in lacrimal gland, so we should give steroids. Okay. And follow-up is there of how many months?
Ma'am, 1 year.
1 year, and there's no recurrence.
No, ma'am. Till now, it's not there.
Okay.
We have been regular.
Okay.
With recurrence, what would you suggest if you see later?
Ma'am, we'll again go for investigation modalities,
Yeah.
and then, ma'am,
Radiotherapy is the
yes, ma'am.
treatment. Good.